Several psychological factors seem to affect progression. Cancer and social support. Social support may not always bestow benefits on a cancer patient. Revinson, Woolman, and Felton in 1983 interviewed 32 patients between 50 and 83 years old with blood cancers, 15 men, 17 women, and over two-thirds who were married. They measured actual support received from friends and family within the past week. The patients showed worse adjustment if they received more social support. Compared to those who received less social support, the patients who received more showed more negative affect, lower self-esteem, greater difficulty accepting their impending death. Lichtman, Taylor, and Wood in 1988 studied family network and marital adjustment after breast cancer. If there was a major change in social support following diagnosis, even if that meant more social support, it seemed to impair adjustment. Why? As prognosis became more severe, more extensive family contacts seemed to occur. Contacts may make it more difficult for the patient to resolve personal fears. Family fears may affect interpersonal interactions. The result may be feelings of conflict or ambivalence that further taint family relationships. Continued presence of family may serve as a reminder. Sandra Levy in 1992 followed a group of stage 1 and 2 breast cancer patients over a 5-year period to examine differences in psychosocial outcomes between those who had mastectomies, removal of the entire breast, versus lumpectomies. Only the lump is removed, the breast remains intact. Emotional distress declined and functional status improved during the 15-month follow-up, regardless of the surgery. At the time of surgery, there were no differences in emotional social support, but by 3 months after, lumpectomy patients had much less energy and emotional social support than the other group. The pattern was still apparent at the 15-month follow-up. However, the lumpectomy group was rated as more functional. People may think that those with a lumpectomy need less support because they see their procedure as less severe. Some studies suffer from methodological problems that make it impossible to determine whether patients develop cancer because they have these personality factors or whether the personality factors develop as a consequence of cancer. There's little proof that psychological factors cause cancer. The link between psychological factors and cancer may be different for men and women. Also, women who were socially isolated had higher cancer incidence, but this relation was not found in men. Suppression of emotion is a stronger predictor than negative life events. Dettori, Shantz, and Coyne in 1980 studied male patients at a VA hospital who had filled out the MMPI, all free of medical and psychiatric symptoms. 10 years later, they were divided into cancer group and non-cancer group. The cancer group was more likely to have suppressed emotion during a period of years prior to the onset of cancer. Dettori in 1980 found cancer patients scored high on the depression scale of MMPI years before developing cancer. Shekel in 1981 randomly selected more than 2,000 men ages 40 to 55. They found a relationship between depression, measured by MMPI, and the development of cancer 17 years later. For men, twice as great as it was for non-depressed men. Persky in 1987 found that depression may promote cancers, but probably did not initiate them. Other research has found no relationship between depression and either cancer, morbidity, or mortality. Gallo in 2000 conducted a study using a large population-based sample in Baltimore and followed approximately 2,000 people for 13 years. Although no link between cancer and depression was found across the board, there was a significant correlation for women. Why all of these different findings? Perhaps it is due to the different measures of depression used. Type C personalities respond to stress with depression and hopelessness, the muting of negative emotions, and have the potential for learned helplessness. They present as conforming and inhibited. As Woody Allen remarked in the film Manhattan, "I can't express anger. That's one of the problems I have. I grow a tumor instead." Dottori in 1980, using MMPI data, compared profiles of patients who subsequently developed cancer with profiles of those who did not. The cancer group was more likely to repress emotions and reported less depression. However, other research found positive correlation between depression and cancer, and other longitudinal studies have failed to find relation of personality traits to cancer. So what does this tell us about the type C personality? It's inconclusive.